This is a Chronicle podcast, bringing you ideas in the service of medicine.
From the Chronicle podcast system, this is Venda on Psoriasis with Dr. Ron Venda. Based on the popular Venda on Psoriasis column in the Chronicle of Skin and Allergy, Dr. Venda provides brief synopses of recent significant clinical developments in psoriasis research, and provides his observations and comments to accompany each report. In each episode, Dr. Venda will answer questions and offer his expert observations and anecdotes on treating this chronic disease. If you have a question for him, or want to be in touch at any time, just send an email to venda@chronicle.org. That's VNDER@chronicle.org. And, if you attach a voice clip, we might even use your question on an upcoming episode. Support for this podcast comes from Sun Pharma Canada. Sun Pharma is a world leader in specialty therapeutics and is now positioned to be an even larger contributor to the Canadian dermatology landscape. Learn more at www.sunpharma.com. And now, here's Jeremy Visser.
From the labs to trials to your office, here comes Dr. Venda on psoriasis. Don't they use that, but do try this. It's Dr. Venda on psoriasis. Dr. Venda on psoriasis.
Welcome back. I'm Jeremy Visser of the Chronicle of Skin and Allergy. You're listening to the Venda on Psoriasis podcast with Dr. Ron Venda. In our 10th episode, Dr. Venda will be talking about air pollution triggering psoriasis flares, ixekizumab response in pediatric plaque psoriasis patients, and treating psoriasis with teledermatology during the pandemic. Dr. Venda, I'm looking forward to hearing your thoughts on teledermatology while we speak through this telepodcast call. Isn't technology wonderful?
Technology is wonderful as long as it works. That's what the old patients always tell me. It's all good as long as it works. Well, that goes with everything, doesn't it? I mean, employees are good as long as they work. So, that's the thing.
Our first study looks at the potential link between short-term exposure to air pollution and psoriasis flares. What was your take on this study, Dr. Venda?
That was a tough study to try and look at. There's so many things that affect psoriasis. When you look at diagrams of what causes psoriasis, it's always like a lightning bolt. Environmental factors, air pollution can do it. People say, in more populated cities with more air pollution, there's higher risk of psoriasis. But, you have to sort of factor in previous infections and stressful life events and drugs that can cause the psoriasis as well. And this study was a 7-year study in Verona, Italy. And I've been there. There's too much pollution there. But they looked at close to 1,000 patients and with over 4,000 visits. And they looked at where they lived, and they looked at concentrations of pollutants as well. Now, the problem is I don't know what the real bad concentration of pollution is. But when they looked at that, and they looked at the values that were given to them by environmental services, in more polluted areas, there seemed to be a higher risk of psoriasis when eliminating other confounding factors. So, patients say, I noticed when I moved to the city from the country, my psoriasis developed. It's hard to say whether that was air pollution or stress involved or higher costs and so forth. So we all like to try and clean up pollution. Will that clean up psoriasis? Probably not.
Our next study looks at safety and efficacy of ixekizumab in pediatric patients with moderate to severe plaque psoriasis. Dr. Venda, what did you think about this study?
Thanks, Jeremy, for the question. So pediatric psoriasis is certainly out there, and having injectable medications for these patients that suffer have shown to be very safe. That's the first thing, as long as the dosage is correct. But the key is safety. So one thing that it does is it allows children or pediatric population to be treated as adults with adult medications in regular doses without the higher risk of side effects. So that's perfect. So that's good. It also gives some comfort to physicians that prescribe to say that, if it's safe in kids, it's probably going to be safe in me. So that also helps. And this study looked at PASI 75 and PASI 90 and PASI 100s in these patients. And it had met all of their endpoints with improvement of itch as well. Nail psoriasis also improved, palmoplantar psoriasis and scalp psoriasis improved, and also genital psoriasis as well. And there was really no particular safety findings at all. The PASI 75 was very high at just over 90%. The PASI 90 at 2 years was 80%. That's a very high number. And PASI 100, 55%. These are very, very good clinical responses to this injectable medication that has shown great success in adult patients without any risk of safety as well. So I think that this is an excellent, promising study. We know that it is approved in Canada for pediatric patients. Just watch the dosing. I think that it has a long life ahead of itself in young patients and old patients.
Lastly, we have a study looking at outcomes of treating psoriasis patients via teledermatology in the Philippines during the COVID-19 pandemic. What are your thoughts on this study, Dr. Vender?
So teledermatology, whether it's in the Philippines or whether it is in North America or in Europe, has shown to be quite useful. The limiting factor is not the physician, is not the patient, but it's the technology. It's the clarity, it's the resolution that you see. And you assume that the physician would know how to properly use a video or teledermatology platform. However, it's the patient that has usually difficulty with technology and difficulty with the video aspect, the audio aspect, the internet aspect, and the connection. So the ideal point would be to have a clinic, let's say the patient's in a remote area, to have a clinic where the camera setup is done. The patient comes to the clinic with a healthcare assistant in that peripheral or distant or remote clinic and connects with the dermatologist. Quite often, though, and I've done this before, the patient is late, so the physician has set aside a half an hour for an assessment and other things could be done. So it's not very time efficient. It's very convenient, but it's not a very time efficient. Now, if everything runs like clockwork and the patient comes on time and you book the right amount of time that you need and you can assess things, I think it's very, very helpful and can decrease travel, decrease in-person contact, and you can have a very good assessment of the patient with psoriasis and be able to treat them appropriately.
Our first listener question this week comes from Vancouver, BC. In your opinion, should psoriasis patients begin deliberately avoiding elevated air pollutant concentrations, or are there more prominent aggravators to be worried about?
Oh, thank you for that. I think that trying to avoid an air pollution area because you have psoriasis is not practical because I don't think it's that strong. The study looked at new cases of psoriasis in air pollution areas or higher cases, not exacerbation of existing psoriasis with air pollution. So I think avoiding things such as stressful situations, certain drugs that may exacerbate, like lithium or beta blockers or antimalarials that could make psoriasis worse, is more important. Avoiding sunburn that could cause kevnarization. Avoiding those factors is certainly more important than trying to avoid an air pollution. For general health, sure. But in terms of psoriasis, I don't think that's practical or necessary.
Our next question comes from a listener in Toronto, Ontario. Can you discuss 2 or 3 of the special nuances to take into consideration when dealing with pediatric patients?
Dealing with pediatric patients becomes a family affair, really. It's unlikely you're going to speak to the child by themselves, depending on how old, or maybe a 16 or 17-year-old. But generally, in a pediatric patient, that would be an adolescent patient. So in a pediatric type patient, a younger patient, you're going to have a conversation with the parents. Sometimes the parents have other partners, and so there could be 4 people involved. It makes it very difficult with a lot more questions, a lot more time consuming. The child probably sits there and is a little bit already scared of being there, hears the word needles and becomes more fearful. So I think that, trying to explain things in plain English to the child and to the parents is very helpful at first. I usually say you have a protein in your body that's elevated, and this needle with this injection is going to try and reduce that. That still can create anxiety and fear in the child. And so sometimes searching for a YouTube video that looks at childhood psoriasis and sees, happiness and joy after the patient is cleared can be helpful. So I think that it's making sure that you speak in terms that a child can understand and not in terms that the parents can understand. So it's just bringing it down to their level.
Our last listener question comes from the Greater Toronto area. What have you found to be the advantages and drawbacks of teledermatology from your personal experience?
I think that the advantages of teledermatology is that you don't have to see the patient. You can do it from your own office or your own home. The patient could do it from their own office and own home. It's extremely, extremely convenient. And the likelihood of a good diagnosis for most times with proper resolution is important. However, I think that the drawbacks of this is that it can be too time consuming for the dermatologist. It's not a truly efficient use of time necessarily for the dermatologist, especially if there is technical difficulties. That is the main drawback. And so it's not software, it's not hardware, it's human use and human interaction and that human point of setting up these teledermatology. As I previously mentioned, earlier in the podcast, I think that the setup in a standardized clinic with proper lighting and a good high resolution camera is very beneficial to try and reduce the technical difficulties that occur with teledermatology. And it is possible as well, but I think that's the real drawback. Certainly convenience is one thing, but it has probably more drawbacks than advantage really.
So you'd say it's more effective on a patient-by-patient basis if one patient has more use with technology and is a little more timely?
Yeah, I believe so, but it's getting to know a patient could say, yeah, I understand all this. And then when you come to set up the camera or the video or the audio, it just doesn't work.
Thank you, Dr. Vender. Listeners, if you have comments or questions for Dr. Vender, send them over. Send an email to health@chronicle.org. Add a voice clip attachment to your questions, and you might appear in a future episode of this podcast. If you enjoyed this podcast, please share it with your friends. You can subscribe at Apple iTunes, Google Podcasts, Stitcher, or wherever you get your podcasts. This podcast is produced in cooperation with Sun Pharma Canada. I'm Jeremy Visser of Chronicle Companies. Your host has been Dr. Ron Vender, founder and director of Venderm Innovations in Psoriasis, a center of excellence for psoriasis offering a comprehensive management solution for individuals with psoriasis. We'll talk again next week.
Don't use that to try this, says Vender on psoriasis. Dr. Vender on psoriasis.